Hello, everybody. My name is Denny Hanson, and I'm a nurse practitioner. I'm at the University of North Georgia. This is my presentation for instrument evaluation assignment for the class Epidemiology and Biostatistics with Dr. Joanna Correga. The study instrument evaluated here is the QoR15, or the Quality of Recovery Score 15. This quality of recovery instrument is a study instrument consisting of 15 questions. It's a measure of post-operative health status. Typically, they will use this before and after, and at certain increments after surgery. So not just one time after surgery, but possibly 2, 3, or 4 times, even up to months afterwards, to assess the quality of recovery of patients after any kind of surgery. Started out with a quality of recovery score 40 in 1999, which has been used quite often in many countries. And then this group decided in 2013 to run a study to try to come up with a scale that was similar yet more concise, but still gave you the same reliability, and was as good at just giving them their overall information they needed after recovery to assess how well patients did without the lengthiness of the 40 question survey. It has took basically every category that the QoR40 had and just cut them down. So everything from pain to physical comfort to psychological support, emotional support, but took certain parts from each one that would work and function together. This version of the QRR was developed in 2013 with the idea that the QRR9 and the QRR40 had their pros and cons, but there was a way to gather more information and do it in a quicker time than the QR40. Their goal is to develop a 15 question scale that has the psychometric ability of the QR40 while also having the capability to use quickly and more often like the QR9. They did a prospective cohort observational study to evaluate the study instrument. Patients were given this survey before and after surgery. Most patients in the study were able to complete it in under a few minutes, which was less than half the time of the QR40, which showed many times patients would not complete it at all after going through it, but patients doing the QR9 and this new QR15 would complete it most of the time. The scoring and evaluation for this scale is very simple. As you can see, it's got 15 questions scored 0 to 10, 10 being the best. Your overall score, once they add it up, excellent would be 136 to 150, good 122 to 135, moderate 90 to 121, and poor 0 to 89. Questions include, have you been feeling well in the last 24 hours? Are you able to breathe easily? You've been able to enjoy food? Feeling rested? Have you had a good sleep? Able to look after personal hygiene? Able to communicate with friends and family? Getting support from the hospital? Able to return to work? And all of these questions go into basically how is the patient not only functioning, but how are they feeling? How are they handling their activities of daily living? The new survey scaled very well in reliability and validity. With the test and retest score, it was excellent and improved from the results of the QR40. The Cronbach alpha was as shown at 0.85, split half coefficient was 0.78, and the test retest interclass coefficient was 0.99, which everything above 90 is considered excellent reliability. And so overall, this new survey tested extremely well in multiple surgical areas and with multiple types of patients and multiple different surgeries as well. In their study, they showed adequate validity, that they were able to draw a valid conclusion from the population that they sampled. They went over convergent validity, construct validity, and discriminant validity. R&P values shown here that you can have confidence in the results that they got, and that this would be an adequate scale to take the place of QR without losing its ability to do the job that they wanted. There isn't necessarily a gold standard to use. However, the QR9 and QR40, as previously discussed, have been used quite often over the years. There's also a visual analog scale that came up quite often in research that has been used as well, and compared to both the QR9 and the QR40, and then more recently the QR15. All these scales have been used in many different countries, many studies, and translated into many different languages. The QoR15 itself, obviously relatively new, but since then it has consistently been used in many studies since 2013, and all have been used extensively throughout this time. When it comes to my proposed project, it is a quality improvement project to improve the quality of recovery for patients after endoscopic sinus surgery. This could include after septoplasty with turbinate reduction, or that plus balloon sinuplasty, antrostomy, sphenoidotomy, ethmoidectomy, even removals of polyps, polypectomy. And so the typical gold standard and what we use in our clinic currently is 2 to 3 times of saline rinses a day for that first week after surgery. There are splints that are placed during surgery and removed at the 1 week mark. Currently, there is no medicine that we instill into the nose, and we do not use any kind of cotton ball block. But there are still surgeons that have been doing surgery for a long time that have not moved to the splints that also still do the packing. So they pack the patient's nose full of gauze and then just remove that instead of having splints, which has been shown that it causes more discomfort than even the splints do. The splints don't necessarily cause a lot of discomfort, but they do cause nasal congestion, and patients just are uncomfortable overall, but not necessarily pain. And so many surgeries have looked at the saline rinses, the splints, packing, using cotton ball blocks instead of using saline, and using some countries have actually used different rhinal ointments instead to try and cut down on crusting and the amount of debridement that must be done in the office at the 1 week appointment. So this proposed project is to most likely try to use cotton ball blocks on one side while the other side is using the saline rinses, and then decide how patients have recovered and use the scale to decide how they have recovered with one size versus the other. This scale, after this research has shown that it should have sufficient reliability and validity to assess this with patients after they've undergone endoscopic sinus surgery. The biggest thing is that it is quick. It's not something that patients will go through halfway and not finish, which is quite often with surveys and questionnaires. With a 15 question survey, it is likely that you could get them to finish it, and my goal would be to have them do it during their pre-op, during their first post-op, during their second post-op at the 3 week mark, and then 4 weeks after that at their last post-op. And this QoR15 should serve that purpose if this project is implemented. And that is my project on the QoR15. Thank you very much for watching.